Happy rainy Tuesday. Welcome to We Got This WA, our webinar series geared to help you navigate this pandemic. My name is Gabriella Buono, and I'm the Senior Vice President of Member Development at the Seattle Metro Chamber, and happy to be your host today as we talk with King County Deputy Executive Rachel Smith about Phase 2, the statewide mask order, testing capacity, PPE, and all that good stuff. I want to start by thanking our event sponsor, the Business Health Trust. Without them, this event would not be possible, so very grateful for their involvement in it. And then dive into a few webinar logistics before we get started with Rachel. If you need technical help, please use the chat box, which is you'll see at the bottom of your screen. That will link you to Lee, and she's able to assist you there. And if you have questions for Rachel, which we're hoping that this will be a little bit of Rachel talking and mostly question and answers for you all on the call, please use that Q&A box there. That's the best way for us to see those questions and get them answered. This webinar is going to be recorded as well, and it's going to be posted on the event page later today. And also we'll do a follow-up email and be including in that as well. So let's get started. I'm really excited to have Rachel Smith, King County Deputy Executive, back with us for the third time. She is a wealth of knowledge and just a really good friend of the Chamber, and we're always happy to talk to her, and she always gives us really great information. So welcome back, Rachel. Just to give you a little background on Rachel, she's responsible for administration of the executive staff, as well as directing strategic initiatives, external and internal policy coordination, intergovernmental relations and communications. She previously served as the Director of Government Relations in the Executive's Office and has nearly 15 years of government affairs policy advocacy experience, including positions at Sound Transit and serving in the administration of Seattle Mayor Greg Nichols. She, again, is going to be taking questions at the end, so please use that Q&A box. We're saving lots of time for that part, so please take advantage of us having access to Rachel this morning. So welcome back, Rachel, and I will kick it over to you for the first part.
Great. Thank you so much, Gabriella. It's nice to see everybody and nice to be back. I always appreciate the opportunity to be here and to talk with the team and to answer questions. And I think, you know, while I've been on a number of times, as you had noted, and I think in some ways I was saying to Gabriella earlier, I feel a little bit like a broken record, but I think we're actually at a pretty critical juncture and moment here. So I am very glad to have the opportunity to talk with everybody today. So as was stated, I think I'm going to focus a little bit on the numbers and kind of what's going on with them, what it means, what's next. Talk a little bit about the PPE and the work we've been doing to get sort of materials into people's hands. And then do really want to have a discussion and a dialogue because my conversation today is going to be, I think, fairly sobering. So I think this is a moment where we kind of really need to dive in together as a community. So when we're looking at the numbers, I think everybody has been perceiving and aware that they are going up. They are going up across the state, not just in King County, but in Western Washington particularly. We, as of yesterday, we had gone up 168 cases in King County this morning, and the numbers are always, we get early morning numbers and then they get finalized at later in the day. We are up another 114. The good news in both of those is that we have not had any increase in deaths, so that is good news. We did see our hospitalizations go up just a little bit yesterday, and as all of you know, you hear me constantly harping on our key indicators dashboard. Hospitalizations and the capacity of our healthcare system is a really critical, it is one of the most important metrics that we have in terms of determining how we will proceed in social distancing and community mitigations to manage the disease. So currently we are averaging about 92 cases daily. The ranges have been between 50 and 168. That's over the last 7 days. And this actually matches the case counts that we were observing at the end of April. So, you know, while we have, and I should have started my comments in this way, thanking everybody for the incredible work that everybody has done to help bend the curve and reduce case counts, and just taken on enormous amount of sort of struggle and challenge to keep this community safe. We are seeing those numbers edge back up. I'll also remind everybody that naturally, when we increase activity, we're going to see the numbers go up. So it is not unexpected. It's really about how much they go up, where they stabilize, and what the hospital capacity is, in addition to testing, as we have discussed. So like I said, averaging about 92 cases over the last 7 days, which is about what we saw at the end of April. As a comparison, at our peak, when we had the sort of worst case scenario happening in this community, which was the last week of March and the first week of April, our average daily new case count was 194. The absolute peak was 220. So again, for perspective, last 7 days we've been at about 92. Absolute peak was about 194. So that gap between what was the sort of worst of the worst and where we are today has been narrowing a little bit, which is concerning. I think you have heard, and you heard from Dr. Duchin, I think last week, the trends have shifted over the course of the outbreak. For the last month or so, Hispanics have been in the largest proportion of cases, with rates much higher than whites. So that is something, obviously, we're looking into from our public health standpoint to understand what's happening there. The rates of confirmed cases are actually highest among Native Hawaiian Pacific Islanders. And then we have, and I think, you've been reading about this in the news, not just in our community, but across the country, we're seeing a significant increase in the last few weeks of people in the 20 to 29 range, and really kind of 20 to 40. But especially in that 20 to 29 range. As I said, while we have not seen significant increases in hospitalizations, we're concerned, especially given the 13 additional that we saw yesterday. So kind of to just do some real talk, which I always appreciate the Chamber for embracing. This is concerning, and I am just sort of always really candid in that I don't think threatening and condescending tones are ever helpful for encouraging our community to come together and do the work that we need to do. But I do think real talk is in order. And so I think when we look at the various tools in the toolbox and the sort of asks that we have of our community, first, I will say, that we can, the Royal We can and will enforce if we have businesses and other activities that are not happening in the manner that they are required to from the state and from King County. So we can do that through public health. That can happen through the city of Seattle, either through their oversight of parks and things like that, through, and obviously King County also has oversight of King County parks. But also in the fact that they, oversee business licenses, obviously Liquor Control Board and things like that, and then through L&I at the state. So, there are enforcement mechanisms that can and will be deployed if necessary to help sort of get a handle on things. I also want to just kind of say this in a very straightforward way, which is, while we are going through these phases and moving to more and more activities being opened up, it is not the same as going back to normal. And so I think that that's just something we really need to remind ourselves is just because you can go to a restaurant doesn't mean you're going to behave in the way you normally did when you went to that restaurant. Just because you can gather with fewer than 5 people, out at a park for a picnic doesn't mean you're going to do that in the way that you used to. So the phases and activities open is not the same as going back to normal. And I think, just to put a fine point on that, we need people to continue to limit activities. We need people to limit risky behavior. We need people to, for example, in the workplace, continue to telework if possible. We need people to continue to wear masks. We need people to continue to stand 6 feet apart from each other, et cetera. And I think, the sort of notion that public health, is going to have to use kind of the extreme community mitigation measures to to get our community to sort of be in the space that we need just is completely unpalatable to everybody, myself included. And so, you know, while we all kind of have to do our part, or we really just have to kind of do better as a community. And I think ultimately, you know, if we want people to be able to get back to work, we have to do better than we're doing right now. If we want, you know, the thing that I think is on everybody's mind about kids being able to go back to school and young adults being able to go back to college, we've got to do better than we're doing right now. I'll take a quick aside and, you know, share, folks may have seen what happened at the University of Washington with Greek Road. That is the kind of thing that is going to keep us from being able to get our young adults back into college if we're going to have, you know, massive super spreader outbreak events like that. And you know, additionally, if we just want to make sure that the vulnerable in our community, so, you know, the older individuals, those who are immune compromised or otherwise have health issues, are going to stay safe, we really do have to do better. So what does it mean? It means a couple of things. One, you know, we are going to be doing just another really large and fierce push to get messaging out into the community. We're trying to think of every creative way that we can, from the government's perspective, to be pushing out that messaging. But we absolutely need support from the business community, community-based organizations, et cetera. You know, if just the public health officials and the government officials and the elected officials are the only ones sort of saying this, it gets a little tired, as I'm sure you all know. And so people being able to hear from trusted voices, people from being able to hear from, you know, those that they look up to, that they see in leadership, it is really critical that those voices are coming forward and that they are coming forward often. I need everybody to be as much of a broken record as I have been. I think we also need to, you know, be kind of putting this front and center in everything that we're doing. So if you have the kind of business that has regular customers, you know, put stuff up in your windows so that they are being, you know, forced to remember what they need to be doing, forced to remember that we're still dealing with COVID sort of everywhere they turn. They see a poster, or they see hand sanitizer, or they see a person in a mask. So we really want that to be the like sort of constant visible reminders. And then, you know, we want to ask everybody to use all the tools in your toolbox from a communications perspective to be talking, whether it's through, you know, your Facebook and Twitter and other social media, through email listservs that you have for your customers, through employee communications. We really want you to be saying that, you know, every single message that you put out there has something about reminding people that COVID is still out there. It is still dangerous, and our numbers are rising, and we've got to keep up with our protocols. And the other thing is, you know, we really need to, I think, as a community, begin to hold each other accountable a little bit more. When you see folks who you are interacting with who are doing things that you know are not safe, say something. You know, say, hey, I don't want to be around you right now because of what you're doing. If you're at a restaurant and they're allowing something to go on, or and I don't mean to just call out restaurants, but in any kind of establishment where something's going on, tell the management you're not comfortable with it, because for every you know, hundreds of good actors, there's one or two bad, and if we don't actually call that out, you know, we do ourselves a disservice. Also, I think this is especially true with young people. It's so easy to go with the flow, and we have to really encourage them. If you're at a socially distanced gathering and there's a group of people being too close and you know, not wearing masks, you need to go over to them and say, hey, I'm going to leave. I'm not comfortable with how you're handling this event. So really just want to get people comfortable sort of verbalizing what we need to be doing, holding each other accountable, and then also helping each other. If it's like, well, I don't know what I need to be doing, then say, hey, I can help you figure that out. So really just want to, you know, I know that everybody on this call probably knows that. I think the point that I'm trying to make here is how very important it is to be getting that message out right now. And as I've said before, you know, as we approach all these challenges that we have before us, as we approach, you know, our metrics and look at what we do, what we need to do, we don't do so passively. So we don't sort of say, oh, our case counts are up, that's unfortunate. we are really looking at everything that we can do to try to bring those numbers down and combat the issues. So, things like testing are one of the tools in our toolbox, things like contact tracing, and then of course, the materials like masks and hand sanitizers. And I think most of the folks on this call know that we are partnering with all parts of our community right now to distribute those kinds of materials. Want to give a huge thank you to the Chamber for everything that the Chamber has done to help with that. So just to give you a little bit of a sense of scale, so we've ordered 25 million, we, King County, have ordered 25 million cloth and disposable masks for our communities. They're coming in batches. I think about 10 million of the disposables and about 1 million of the cloth came in yesterday. So the partnerships are sort of across the community. Working with the chambers, we've given 1 million, I believe, disposable masks to the Seattle Chamber, to the Bellevue Chamber, and to the Seattle Southside Chamber, so South King County. These chambers have also received, I think, about 800,000 cloth masks as well to be distributed to businesses. We've also distributed 470,000 cloth masks to our city partners, so our 38, not including Seattle, cities in King County, except Federal Way, who asked not to participate in the program. 64,000 masks have been set aside for unincorporated King County. And I just see the great timing. The chambers have actually launched this website, safestartkingcounty.com, which is great. And I believe we're sponsoring the first in-person distribution this Wednesday. The cities are also sponsoring mask distribution days. And I think the first one is actually this week in the city of Shoreline. So, between our cities and our chambers, just a huge push and effort to get that protective equipment out into community. Speaking of which, we also are partnering with community-based organizations and faith-based organizations. We've received orders for masks and hand sanitizers from over 500 groups, which is great. And that includes orders for cloth masks, disposable masks, and bottles of hand sanitizer. I think at this point, all of the hand sanitizer that we bought at King County has been requested and sort of spoken for at this point. And then we're working with the King County Library System, which is not actually a part of King County county government, to set up 6 different distribution sites across the county where these community and faith-based organizations can pick up the supplies that they ordered. So that's a lot of detail, but I think the point here is that we are trying to push this into every corner of our community so that at no point does anybody say, I need and I don't know how to find personal protective equipment. We really have made a huge financial and sort of community-wide investment to say, what we do here in King County is going to be done safely, and if you need a mask, you are able to get one. The last thing, and I guess I'll also share, we also are distributing some through our King County Council members' offices. Obviously, they have very close and deep community ties, and so that's an easy way for people to get connected. And then our Department of Local Services here in King County for the unincorporated area will also be working with community-based organizations. So the last thing I will talk a little bit about, and then we can open it up for discussion and dialogue, is around contact tracing. I think I really want to remind folks that contact tracing is the tool in the toolbox that helps have us not have to go back to extreme social distancing. So, when you test positive and we are able to quickly understand who you came in contact with and quickly quarantine and isolate those individuals, we immediately stop the spread that has been happening from whatever happened in that activity area. So it is just absolutely critical. And I know that, frankly, it's odd. It is odd that the government is literally calling and saying, I need to know what you've been up to. I know that, there are folks that feel that it's invasive, and I understand that. I know that there are privacy concerns as well, and we are working through that right now. I think Dr. Duchin might have mentioned, if anybody was on the call with him, that Challenge Seattle, which is obviously a business partner of the Chamber as well, has been working on some best practices documents. At the same time, King County Public Health and the Department of Health have set up a small work group to work through some of the issues around contact tracing. King County is doing that work primarily right now. Any of the cases that we can't do ourselves with our in-house contact tracing team, the state Department of Health is doing, but most of the cases we're doing right now are being done by King County Public Health, and we have a really robust contact tracing program. I think for you as business community members, a couple of things that I would flag is that, you know, one, we want to encourage you to be prepared and make a plan. So if you, you know, if the unfortunate reality happens that you have a case or a series of cases in your place of business, that you have a plan and you know what to do. The second thing is to establish a COVID-19 point of contact. So that is, you know, the sort of one person within your business that public health can work with directly to, you know, handle whatever needs to happen, figure things out, get contact information and things like that. We, meaning King County Public Health, will not be keeping sort of a master spreadsheet because obviously people's jobs change, their phone numbers change, they take vacations, they take days off, they're sick. And so what we ask is that individuals who have identified a point of contact, so whatever is the phone number that, you know, you look up when you Google or otherwise find the phone number for a business, whoever answers that phone has the name of that point person. So your, you know, front desk folks, your reception, your call centers, so that when public health calls and says, hey, I need to talk to that point person, that they direct them to that individual. Not that we would be trying to keep spreadsheets for all the businesses. It simply would be just too enormous a task to keep updated regularly. So that is one of the asks that we have for business. Also, we want to encourage people to sort of strengthen any channels that you have internally to quickly identify COVID-19 cases. So, you know, if you're doing regular temperature checks, if you're asking employees how they're feeling, you know, those kinds of things really are helpful to help people know if they need to get tested. The faster they get tested and see their results, the faster we can get a handle on it if they are in fact positive and having an outbreak. And then the last thing is really taking swift action once a case has been identified. So, you know, it can feel, I mean, you know, I say this often to all of you. I also oversee an enterprise here. And so I have had these same experiences that you have. It feels a little bit overwhelming when you start to understand that some of your employees have tested positive. It's sort of like, okay, what do I do now? And one, we want to encourage you to just really support that sick employee. It is as scary for them as it is for you as an employer. We also want you to, you know, quickly take actions, even above and beyond what you have, to protect the health and safety of others in the workplace. So try to minimize that, the spread of disease there. And then, you know, again, we really ask that you partner with health, whether it's King County Public Health, whether it's the sort of health resources you might have in your own place of business, but to really engage in a partnership to help figure out what can be done and done quickly to reduce the, not just workplace, but also the community transmission. So that's just a little bit on contact tracing. And again, as we continue to generate resources and materials on that, we will be pushing those out to everybody in the business community and beyond. So with that, Gabriella, I think I will stop there if that works for you, and I'm happy to answer questions and have further discussion.
Great, thank you, Rachel. Yeah, thanks for just being super candid with us and letting us know the real talk, if you will, and for the masks as well. That's going to be super helpful and great resource for our small businesses.
And thank you guys so much. I mean, your leadership and you as a chamber, but the chamber's in general leadership has just been exceptional. So thank you.
Yeah, definitely a group effort. I know I will be at one of the stops tomorrow to help distribute along with some of my colleagues. So it'll be a good way to spend the morning. Just some questions we're getting about testing and about tracing. So first, just a clarification question. Mm-hmm. Are the case references for positive tests or positive results actually active infection, or are they combined with that antibody test as well?
So every positive test, tell me if this answers the question. Every positive test is required to be reported to Department of Health and Public Health. So if a positive test happens through any of the channels that testing happens, it gets sent to Public Health. So we are tracking, and Department of Health, which is where we get our data as well.
So would a positive antibody test be included in that count?
It should be, yes.
It should be, okay.
Yes.
Thank you. And then there's a question about just that testing, more capacity to test versus more cases, and just how you think through that. Like, there's obviously more people are getting tested, there's more tests available, therefore the numbers are higher. And so how do you kind of balance that? Just are we really having more cases, or are we just discovering them?
Yeah, and I'm a little out of my sort of epidemiologist depth here, but so in terms of being able to answer that really, really, really specifically, but testing, as with sort of everything else that we look at from a public health perspective, it's not the entire story, and so I think that's really the way to think about it. Obviously, with significant increases in activity, the disease is spreading. And so testing, depending on how we're testing, could account for additional sort of rooting out of the disease. That's particularly true when we look at some of the surveillance testing and things like that is going on. But by and large, most people are still getting tested because they have symptoms. Most people are still getting tested because they're sick. And so that testing didn't reveal that. That was their own symptoms revealing it and then getting a test to confirm it. So I think, honestly, it would be really helpful if we stopped saying that, of course, additional testing has nothing to do with the increases in cases, and or on the other side, it's all just increased testing and this was all there and nobody's getting sicker. The answer is absolutely in the middle, which is that more testing shows where more disease is. And especially because as testing becomes more available, people who might have been in a room with somebody who was tested positive, now that testing is more available, that person may choose to just go get a test, whereas in the past they might not have been allowed to get one because testing was more limited. So in that way, yes, that's a person that would have otherwise not been qualified to get a test that got one, and that's nothing but a good thing. But it really is a combination of both.
Yeah, thank you. So how do you anticipate testing capacity growing? And then also, who should go get tested? Only if you feel like you've been exposed or have symptoms, or is there a rule around that?
Yeah, so couple of things. Testing will continue to increase, and we have, I think at some point last week, we had doubled or tripled the amount of testing from the week before. And so, testing is again, it is a huge tool in our toolbox. So, if you, for example, have an outbreak, I mean, in sort of an ideal world, if you had an outbreak in a business, let's just say, you would be able to test everybody immediately and then test them again 3 days later, and then test them again 3 days later. And, because testing is a moment in time, right? Because of the incubation period of disease. We're not quite there yet. And I don't know quite how we get there without the federal government taking a much stronger role in testing supplies and things like that. But that would sort of be the ideal situation. But again, testing is not it's not the means to an end. So really, like, infection control is the thing that has to go along with testing, because it is that moment in time. So it's being able to say, okay, we've tested a group of people who had come in contact with somebody, they're all negative, and now we're going to keep them negative by putting infection control measures into place, sanitizer, all the stuff that we all know and talk about. So, so testing, I think folks have heard me say this before, testing has a couple of roles. One, it is for your own personal health and to understand if you have the disease and what you need to do if you do. Two, it is for surveillance of trying to actually understand how the disease is moving through the community. And three, it is a tool that anytime you know a group of people is negative, you can sort of lock that down, right? So that is, I mean, if you will, that's, you know, how we've approached a lot of the long-term care facilities where you have the most vulnerable individuals. It's sort of like, if you can test and you can put in infection control and you can test again and those individuals are negative, then, and you keep those infection controls strong, you have a pretty good sense that those individuals are going to continue to be safe. So it really has kind of all three of those roles still today. But, you know, I think from our perspective, it's a tough message because on the one hand, it's like, we want all the testing all the time. we want everybody to be able to be tested all the time. And that way people, you know what they need to be doing and how to be caring for themselves and others. And testing is not the only thing, because if you're sick, you're sick. And we need people to stop being sick, you know? So I think it's really, they just kind of have to go hand in glove, the actual testing and then all of the things that we do to keep people from getting sick.
Great, thank you. A couple tracing questions. So a question if we have enough contact tracers, especially with the given rise in positive cases, and then also a question around just, you talked about a little bit, maybe just reiterate what King County is doing around contact tracing, and then if you know about the state level as well.
Yeah, so the answer to do we have enough contact tracers is kind of. I mean, we are mostly able to, well, actually, in the last couple of weeks, we have had enough staff to be able to do almost all of the contact tracing for King County. And so that has been a good thing. We are also continuing to ramp up. So we have hired staff, we continue to hire staff. And because again, with opening, we know cases go up, we need more staff. So we have been able to do most of the contact tracing with King County centric staff. The state and the counties, the state and all of the counties do contact tracing a little bit differently. And so, you know, I think, and this is not in any way a knock on the state or DOH, it's just every community is obviously very different. And King County has the most activity of anybody. We have more diversity than, say, you know, some rural counties. We have different kinds of activity. And so we would really, with the support of the state, we want to be able to do all of the contact tracing for King County. In King County, we have the relationships with the businesses and with our community. Our public health department, I think, is very well respected in terms of how they conduct themselves. And we also can ask and really do a deeper dive into some of the questions and the sort of investigations, if you will, that are King County centric, because we're here. So, you know, we are continuing to, and we will always be partnering with Department of Health on all of this, but we are still leaning on them a little bit for contact tracing. But the idea is, especially if we can get it in place this summer before whatever might happen this fall happens, that we would really have a really solid contact tracing program that we would be able to deploy anytime as needed. We have always done contact tracing at King County. That is a natural part of public health. I mean, HIV is a good example of contact tracing programs that are robust and are long-term. But obviously we had never done it on this scale. And so that's really on this scale and for a different kind of disease. So, you know, it's easy to think, for example, that because I sat at my computer and I typed, and then I left for 24 hours and somebody came back to my computer and they typed, that they might get COVID. That's probably not the case because we know that the disease, you know, transmits, the most likely transmission is from close contact and with other individuals. And so, you know, we don't want to spend our time on tracking down things that are unlikely to have spread disease. We want to spend our time really focused on the things where the most likely transmission of disease happened.
Great, thank you. Some very specific questions here from Amy. So if an employee, if as an employer, one of your employees has a positive test, do they need to report that to the Department of Health?
They don't have to. It will get reported from the healthcare provider that, yeah, the whoever administered the test is required to report it, and so the employee doesn't have to, and then that will trigger into public health the need for contact tracing. That being said, and we are, I think all of you know, we are really trying to hone our ways of people coming into and interacting with public health. Obviously, we have a bunch of phone numbers, and anybody that has my phone number calls me, and that's all sort of working for now. But we also want to make sure that the onus is on health to do that outreach, but we also want to make sure that when people feel like they need to come in to ask questions, that there's a real easy way to do it. And that's a work in progress naturally with everything that has sort of inundated the public health system. And now as we're sort of clawing back out of that a little bit, we can put some of those better systems in place. But yes, so just to answer the question very specifically, all positive tests will get reported. And when they do, we would, deal with each of those cases individually.
Right. And provided, reported by the provider, not the employer.
Correct.
Yes. Okay. So as cases are rising in our county, across the country, and a lot of areas are, regressing or stopping the reopening, if you will. Two questions to this. One, if a business was scheduled to reopen in this phase 2, do you foresee that being affected with the cases rising right now? And then the second part of that is like, how does this set us up for then moving into phase 3?
Yeah, great questions. So, we do not want to move backwards. And that is, I think, something that Dr. Duchin and the county executive feel, one of the things they feel the most strongly about is that we do not move backwards. It just is devastating to think about doing that. So as far as, sort of, if you were scheduled to open in phase 2, are things going to close down? I mean, that is nobody's plan right now. I do think, and again, just being candid, if our numbers continue to rise, some additional community mitigations may be on the table, and it may be around gatherings. It may be around certain kinds of activities related to certain businesses. I think, like I said, the health folks and the executive are loath to have sort of sweeping closures again, because, for all the reasons. So, so that is the current trajectory, is that we would not be moving backwards, but that if we did have to take some actions, it would be in sort of different areas without sort of the sweeping phase. As I said, enforcement is a tool in the toolbox to try to really sort of ferret out the bad actors, because we know that there are fewer of them than there are good actors in terms of how people are providing business. And I think, again, it's really holding each other accountable as customers, as patrons. I think a lot of businesses are doing their best trying to get it right here. And so we need to show up for those businesses as community members in a way that helps them stay successful and stay open. As for the move to phase 3, that's a challenge. I mean, the way the phasing system is set up, both from a state requirements perspective, but also from a just best practice for public health perspective, is that there is a mandatory 3-week window in between going from one phase to the next phase. That is to allow for a full 2-week incubation period of the disease. Well, it's for a week of activity to land, and then a full 2-week incubation period for the disease, thus making 3 weeks. Given the number of cases that we have seen rise in such a short amount of time, I can tell you right now that the health folks are not looking at, I mean, unless something changes, you know, that 3-week horizon is not looking good. I mean, that's just the reality right now. So, you know, I think it's at this point going to be how does the hospital system do? How do our cases plateau and level out, and where do they plateau and level out? And then is it in fact a plateau and the level out? Because I think only then would we be comfortable adding additional activities. And, you know, I think there's sort of King County specific stuff. And then there's also all of that is within the framework of the state. So, you know, certainly if the state decided to limit a certain kind of activity, that would apply here as well. But for us, you know, we would try to take a scalpel instead of a broad brush approach to any changes that we might make.
Yeah, great. Again, just a reminder, if you have questions for Rachel, please use that Q&A box at the bottom of the screen. Just to go a different way, I guess, parks and play areas in King County are reopening. Mm-hmm. Any just words on how these areas are being kept safe? And do you see that kind of the parks in general rolling back or closing as a first step as we go into summer and people want to get outside into the park and go get that vitamin D?
Yeah.
Any thoughts around that?
Yeah, we have lots of thoughts about it. I mean, it's a challenge because I think, I mean, and again, if Dr. Duchin was sitting here, he would say this even more emphatically than I am because he's a health guy, is that getting outside and being able to get fresh air and sun and exercise or relax or whatever you do outside is like really important for our mental health. And it is really important for our mental health when we are in one of the most challenging and sort of confined times of our lifetimes. And so, you know, the last thing that Dr. Duchin wants to do is limit people's ability to do that. There's also obviously a huge equity component to this as well. You know, if you have your own fenced yard where you can step out of your single family home or your townhome and be in your own fenced yard, you can get outside. If you lived in a very small apartment, you know, our community open spaces are the only place for you and your family to go. And so again, it is not a thing that we want to do. That being said, we're seeing a lot of troubling activity at parks and in play areas, you know, where people are having, you know, barbecues and there's 20 people there and they very well may be all family members, but the reality is they don't all live in the same household and they're all getting too close to each other, you know? And mm-hmm. So again, our approach would, you know, if we, as things evolve, our approach would naturally want to be to do what we did when we started the shutdown, which was go out, talk to people at parks, tell them to separate, you know, shoo them home if they're behaving badly. We don't want to obviously arrest people and, you know, put them in detention and things like that. That's not really on the table, but do have a strong presence to tell people like, hey, it's not okay what you're doing here. You need to get moving. And for those who are being safe to see that this is safe behavior and you can stay here. Mm-hmm. So that would hopefully be the first step that we would take if there was concern there. But you know, we really do need to see people, you know, following the rules, for lack of a better term, even when they're out and about. And also for people to not worry when they are being safe. I mean, if you are sitting in the sand on Alki Beach and you are, you know, 10 feet away from folks over here and 15 feet away from folks over here with your family unit of 4, you're fine. You know, you're not going to be infecting other people. It's really when you're doing those other kinds of activities that there's a problem.
Yeah, great. Thank you. Well, I think we're about done. And just to wrap up here, I mean, it sounds like just thinking about the mandatory mask order from the state as well, and just how businesses and what you said, make sure that as business community and just as community, making sure that we're, you know, policing ourselves and the people around us, and businesses are putting up those signs and enforcing them in their places that people are staying safe is our biggest call to action here, is what I'm hearing, to make sure that we're not sliding backwards into more cases, but moving forward and getting on to phase 3 and not being, you know, something that we don't see for a while. So anyway, Rachel, thank you so much for your time again and the information. It was super helpful to have you, and I'm sure we'll see you again another time for your fourth appearance here on our webinar. But thank you very much for your time. It is much appreciated.
My pleasure, and thank you all for your great work and for everybody who participates in these to help get and share information. We are relying on you as community partners, and you always step up. So thank you so much.
Thanks, Rachel. So for the next We Got This WA webinar, it's going to be this Thursday, July 2nd at 11 a.m. and it's going to feature Chris Reichdale, the superintendent with the Office of Public Instruction for Washington State. So it will be a really fascinating conversation on Thursday as well. So hope to see you then. Thanks for joining us and enjoy your day. Bye.